Here is something your doctor probably never told you about your neuropathy. Your small nerve fibers are not static. They are in a constant state of turnover, dying back and regrowing all the time, even right now. In a healthy metabolic environment, the rate of regrowth keeps up from normal dieback. In chronic neuropathy, degeneration is outpacing regeneration. That distinction matters enormously, because it means neuropathy is not in a fixed state you are stuck with. It's an ongoing biological process, and the research shows that process can often be redirected. My name is Dr. Michael Fitzmaurice. I trained as a peripheral nerve surgeon. I spent years studying how nerves fail and how they recover. Today I work with patients online to help them do exactly that. Rebuild nerve function through the evidence that actually supports it. So here is the actual biology of dealing with neuropathy. Your smallest nerve fibers, the one responsible for pain, temperature, and early autonomic function, are called small fiber or intraepidermal nerve fibers. They extend from your nerve trunks all the way into the outer layer of your skin. These fibers are constantly being maintained. They degenerate at their tips especially, and regrow from the nerve body. It is a continuous process, not a one-time event. When that maintenance system is working well, fiber density stays stable or improves. When the metabolic environment is chronically damaging, sustained high blood sugar, oxidative stress, inflammation, the rate of degeneration exceeds the rate of regeneration. Over time, you'll lose fiber density. That loss shows up as numbness, burning, and diminished sensation. This is an ongoing process, and that is actually a hopeful part, because an ongoing process can often be redirected when you address what is driving it. So what is the tipping balance toward degeneration in chronic neuropathy? Three main drivers, and all three are at least partially addressable. First, sustained metabolic stress. Chronically elevated blood sugar generates oxidative damage to nerve fibers faster than they can maintain themselves. The turnover system is working. It is just losing the race. Second, impaired microvascular supply. Your smallest nerve fibers depend on tiny blood vessels called vasa nervorum. When those vessels are damaged by metabolic disease, the nerve fibers they feed are starved of oxygen and nutrients. Regrowth slows, degeneration accelerates. Third, systemic inflammation. Inflammatory signaling can be an independent driver of small fiber loss, separate from glucose. This is why neuropathy can progress even when blood sugar looks controlled on paper. Addressing these three can help shift the balance in your favor. Multiple studies show that improving metabolic control, vascular health, and inflammation is associated with better nerve function over time. The next video in this series covers the most accessible tool we have for shifting that balance toward regeneration and the clinical trial data behind it. If you want the full framework, it is available at drfitznutrition.com.